Howdy, folks. If you don't understand and know about shock, you will not pass this class. Shock. What we do as EMTs is all about shock. All right, thoughts for the day. Self-worth, integrity, and progress are not measured in what they say. It is measured in your actions. The largest measurements are when you have made a mistake and the actions and choices you make after you made the mistake. Any questions? You can choose to blame other things and other people and other agencies and continue with the same pattern of failure or making mistakes, or you can learn from your mistakes, make the proper adjustments, and move forward and become better. Any questions? All right, what are we gonna learn that? We're gonna learn what shock means, how it works, what pathophysiology means, how it works, what causes it. We're gonna go over the types of it, how to know it when we see it, how to do the assessment, and what to do about it when we find it. Any questions on the objectives of this presentation?
What you say? Pathophysiology?
Pathophysiology is how it works. Pathophysiology. So shock's definition is hypoperfusion. You are not able to get enough oxygenated blood and nutrients to every distal cell in your body. That's what shock is. Low perfusion. It's a failure of one of the three parts of the circulatory system, or a failure of multiple parts. There's three parts to your circulatory system. When that happens, glucose and oxygen, which are the fuel cells need, don't reach your distal cells. Hypoperfusion for too long will kill the organs because your organs are all made of living cells. Organ death will lead to you death. Any questions?
Just repeat what the first sentence you said. It was so simple.
You expect me to think back that far?
Just shoot my shot.
The three parts, there are three parts to circulatory system. A failure of any one or more of those three parts will lead to hypoperfusion. So, since I taught this class in fire forever, the analogy I always use of the circulatory system in shock is the same as getting water on a fire. In order to get water from the tank of your engine to the fire, you need three things, right? One, you have to have water. Two, you have to have a pump. Three, you have to have a correctly sized hose. Any one of those three things fails, you will not get water out of the nozzle, correct? The firefighters should, right? Well, your circulatory system is the same way. You gotta have water. Water in your circulatory system is called blood. Yeah, plasma, blood. Then you gotta have a pump. The pump would be your heart. Then you gotta have hose, which would be your veins, your blood vessels, arteries and veins. So one of those three fail, or multiple, two out of those three fail, you end up in hypoperfusion. The layman's term of hypoperfusion is called shock. Any questions? There it is. I used to have a really good animation going around. Really wasn't that important. Heart, blood, vessels. one of these three is not working properly, you will have shock. Two of those three are working properly, you got even bigger problems. Any questions?
Right. How common is shock for you?
Common. I see people in compensated shock all the time. Fortunately, not very often. Because if you find some decompensated shock, you're behind the 8 ball. They're in big trouble. Now here's something we hope you'll really like.
Shock or hypoperfusion is the inability of the circulatory system to supply cells with oxygen. In early stages, symptoms occur as the body attempts to compensate for blood loss. Physiological causes of shock are the heart failing to pump, loss of blood volume, or blood vessels dilating, creating a vascular container capacity that is too great to be filled by available blood. Categories of severity are compensated shock, presents as an increased heart rate, increased respiration, and constriction of peripheral circulation, which results in pale, cool skin, and in infants and children, increased capillary refill time. Decompensated shock starts with low blood volume or lack of perfusion. Symptoms include falling blood pressure. Shock is irreversible when perfusion to the organs cannot be restored. Cell damage occurs, especially in the liver and kidneys. Even if vital signs are restored, irreparably damaged organs may cause death. The main types of shock are hypovolemic shock, caused by uncontrolled hemorrhage, internal, external, or both, or by plasma loss in burns or crush injuries. Cardiogenic shock occurs during a myocardial infarction or heart attack. Damaged heart muscle or electrical malfunctioning decrease the strength of the heart's contractions, causing a slow, fast, or irregular heartbeat. Neurogenic shock may result from the uncontrolled dilation of blood vessels due to nerve paralysis in spinal cord injuries. There is no blood loss, but the blood vessel dilation increases the capacity of the circulatory system, and available blood can no longer fill it. Sepsis, massive infection, or an anaphylactic or severe allergic reaction may also cause shock from blood vessel dilation. As an EMTB, you do not need to diagnose the type of shock. Instead, you must recognize and treat for shock whenever there is a mechanism of injury or signs that indicate the possibility of shock.
Any questions? All right, so when the heart fails, becomes too weak, you can't pump the blood. You got plenty of blood, your vessels working properly, but due to a heart attack or heart disease, your heart can't pump enough blood to get it to the cells. That results in cardiogenic shock. Or there could be a mechanical obstruction of the heart, which we'll go over in chest trauma pretty soon, which is called a pericardial tamponade or a tension pneumothorax. It's squishing the heart so the heart can't expand and beat as it's being crushed, which is a mechanical obstruction of the heart. That's distributive shock. Or obstructive shock. That distributive obstructive. Any questions? All right, blood loss and fluid loss. This is one you're going to come across the most. Your heart's working fine, your vessels are the right side, but you've lost all the fluid or all your blood. This is like what happens when you get a major rupture or bleed, or you become extremely dehydrated from being sick. Any questions? Then you've got distributed shock. This is when your vessels fail and they dilate. So you got plenty of blood, you got your heart's beating fine, but now your vessels are too big. That could be from septic shock, which is from infections, neurogenic shock, which is a spinal cord injury, anaphylactic shock causes that, which is a severe allergic reaction, and psychogenic shock, which is when you freak out when you see something you really don't like. Any questions about types of distributed shock, which is from widespread vessel dilation? This is neurogenic spinal cord injury. I will be going over it in more detail in the next few slides. So this youngster here is a great example of someone that can go into neurogenic shock. See that? You know what they call that? Scorpion. Scorpion. See, he's a scorpion.
Is that like the inverted fencing position?
No, it's like what snowboarders and skateboarders do.
Yes.
They scorpion. When they plant their face and their feet keep going from the kinematic energy. Anyway, that often causes spinal injuries when you do a scorpion. Because humans aren't supposed to be in the position of scorpions. Their feet can't sting anything. It's completely pointless. So, if you get spinal cord damage, your spinal cord, your medulla oblongata, sends out signals that regulate the vasoconstriction, the vasodilation of your arteries and your blood vessels. That's how they heat and cool your body. That's how the fight or flight works. Well, those nerves are damaged, they can't do that. So you'll get widespread vasodilation. This is the default mode, which will then drop your blood pressure. You won't be able to perfuse at all. Any questions? And that's called neurogenic shock. Spinal cord trauma causes vasodilation. Your body's no longer able to vasoconstrict to compensate for things. Hot, cold, saber-toothed tigers. Any questions? So sometimes you can lose two, your vessel and your fluid. So when you get severe infections, you can become dehydrated, and also the infections can damage the walls of the vessels, so they can't vasoconstrict. So you end up with widespread vasodilation and a lack of fluid. So the fluid leaks out of third space. That's called septic shock from a severe infection. That third space is all the fluid, plasma out of your bloodstream, and damages the vessel's ability to vasoconstrict because of that. Maybe try. So, part of the vessels.
Yes.
So what it does is the infection will damage the walls of the vessels. So they stay vasodilated, they cannot vasoconstrict. And at the same time, you lose fluid outside of the vessel, it's called third spacing. So then there's no fluid inside the plasma. So it's a double whammy septic shock. It's, yeah, third spacing goes to the third position, you start getting edematous, you start swelling up. It's ugly stuff. Septic shock's one of the lead killers out there, yes.
Can you have like isolated shock to certain parts of your body and all with like an infection? for
That's a
example?
great
question, not generally an infection, not sepsis. But I have seen in rare occasions neurogenic shock, where like part of the body will turn completely pale because those nerves aren't working, and then it will pick up and another part will. I've seen that with broken necks, which is really interesting, but I don't know if there's any case studies on that.
Was the space all in between the
Third.
The third?
Yes. Any questions? Anaphylaxis. So true anaphylactic shock is pretty rare. I've only seen it twice in my entire long career. I've been around a long time, remember? I delivered baby Jesus in the manger. That's how long I've been around. I've only seen true anaphylaxis twice. So true anaphylaxis is when you have a severe allergic reaction. When an allergic reaction is your own immune system reacting to a perceived threat. It's trying to stop that threat. It thinks something's trying to kill you, so your immune system kills you before the other thing can. That's what anaphylaxis is. Exactly. So what it does is it shuts down your airways, dilates your vessels, and puts a bunch of goop in your airways so you can't inhale more. Your blood pressure drops, and your respiratory system shuts down.
What is the goop consist of exactly? What does the goop consist of?
Mucus.
Is it more mucus?
Yeah.
Oh, okay.
Here's the terrifying thing. People can go from no symptoms to dead in 10 minutes without anaphylaxis. That fast. Yes.
So then, something like having, you're allergic to bees.
Yes.
You get stung by a bee.
Yes.
It's not the poison that's affecting you, it's your body's response.
It's your body's response to it.
Gotcha.
And usually bees, you get what's called a local reaction. You'll get a hives, you'll turn red. But when you get anaphylaxis, your whole body turns red, your blood pressure drops, you can't breathe, it shuts your throat completely off.
So why do some people vary? with
What's
how-
that?
Like, why do they vary for how allergic they are, different people?
Everybody's immune system is unique. No two people have the same immune system, the same immune response. And a lot of it depends on their environment, what they've been exposed to, and or how compromised their immune systems become with their age and their environment.
That's
So-
why sting could cause different outcomes on the same person.
Absolutely.
Yeah, okay.
Could kill you in 10 minutes, could make you really sick, or it could do nothing at all. We got a whole chapter, we'll go to that after midterm.
I have a question.
Yeah.
So when my skin gets super cold, I break out in hives.
Yeah.
What if I just like broke out in hives for like very bad? Yeah.
Generally just those call that a local reaction. Didn't shut off your airway, and your blood pressure didn't drop, no blood going to your brain. Call that a local reaction. And you can be allergic to anything. Anything that's exposed to your body, your immune system can respond to it. But it's physically impossible to be allergic to something the first time you're exposed to it. Because your body has to recognize it, know, and think that it's bad to give the exaggerated immune response the second time.
Somebody. I'm sorry. If somebody has like anaphylactic reactions to something that they're allergic to, they have the ability to like do small exposures to become not allergic to it.
That's how you cure it.
Okay. Is that why?
I was one of the first test subjects as a child.
Is that why like anaphylaxis is so rare? Just try to make sure that everybody has it.
I don't know. No, I think it's just because there's only like 200 deaths a year from true anaphylaxis. It's pretty low. Because people die every second of every day. The 200 deaths a year in a nation of 350 million people is pretty low. But the way they get rid of this, and we'll go over this when we do allergies. Yeah, the way that they cure you from allergies and potential anaphylactic death is, they identify, they do what's called a scratch test. They take a spike board, they press it into your back, it hurts like hell. And then they take every allergen known to man and they have it inside of a serum. and they pour it into the holes, each one of them, they're numbered. They see what your body reacts to. If you get a hive on that hole, they know you're allergic to it. So they take all the things, the hive, they write it down, they combine all that into one mixture for you. Then they give you injections twice a week. Your body reacts like I used to have when they first started this. I was one of the first people that ever got them. I was like 8. And I would have reactions. Literally, I'd have hives that would go from my elbow to my shoulder. And I had to do it for almost 4 years. But then after 4 years, everything that I was allergic to, I wasn't allergic to. It actually does work. But you have to get intramuscular injections twice a week for years to get it to work. And they keep, when you stop reacting, you go, I got better. It's like, no. Then they up the dose. They hit it again.
Can a fetus be allergic to something?
Yes, because they have mom's immune system. But then they'll develop their own immune system within about 30 days to a year.
So like when they're in stomach, whatever the mom would. be
Not
allergic to.
when, so the moms are, they're on their own mom's circulatory system when they're in utero. They're not on their own circulatory system. They're on mom's.
But they wouldn't develop an allergy inside of the belly.
It would be mom's. Yeah, it wouldn't work because it's not, if mom was allergic to it, the same thing's gonna happen to the baby. Once the baby's born, then the baby's on their own circulatory system, but they still have mom's immunities, which will wear off. It's a very passive immunity. But the other thing too, with kids is kids' immune systems are so incredibly strong. So they get sick really easily, but they also get better really fast too. Psychogenic shock, my favorite. This is when people freak out, and pass out. They freak out, they vasodilate, they pass out, and then they wake up. There's never been a case, documented case in the world of psychogenic shock having a negative effect. Unless like you're sitting on a bar stage at Grand Canyon, you fell. Sometimes they'll get injured when they fall and they hit your head. We get it every year in paramedic class when we do IVs. Somebody sees blood or an IV and they go, hey, plunk. Yeah. No, different physiology. Panic attacks and anxiety attacks generally end up in hyperventilation, which is completely different. Then what they do is they blow off too much carbon dioxide, their blood gets alkalotic, and they also pass out like that. And then it resets just like psychogenic shock. So the results are the same. So that's kind of true, but the physiology is completely different. Whereas in with psychogenic shock, they see something that to them is horrific psychologically. And when they do that, they entirely vasodilate and no blood goes to their brain and they faint. And then when they get supine, then the blood rolls back to their brain, they wake up, they go, what happened?
Is there a reason why they vasodilate so hard?
It's a response to the horrific thing that they're perceiving.
The respiratory center.
Not respiratory, it's the vasodilation center of the brain. Yeah, I don't know why it doesn't. Yes.
So, for example, when I was 16, I got my first blood drawn to donate it, and I passed out and
Yep.
vomited everywhere. That's the same thing?
Yep.
Okay.
So you vomited everywhere because there's no blood going to your stomach either.
Yeah.
You prevent it? Yeah. Say the way those allergy shots, keep looking at those horrible things again and again and again to get over it.
Yeah. I went to a code red and we walked through it. And all it effects and stuff. And the guy actually didn't have like the bottom half of his leg, and one of the kids walked in.
Wasn't I really bad at a car accident once? And I was asleep and then I woke up and we were like crashed and I got out of the car and I thought I was on fire and I was freaking out. Was that like a panic attack?
No, that's just severe anxiety from the incident. That's understandable. Yes, matter of play. So, when we're talking about hypovolemic shock, hemorrhagic shock, there are 3 stages. This is critically important. So I have endless test questions. The entire trauma system is based on this. So remember we talked about before about when someone has a mortal injury, they either die within the first 5 minutes, but if they make it 5 minutes, they generally last an hour. Very, almost nobody dies between 5 minutes and an hour from traumatic injuries.
This is the exception.
No, this is what it is. The reason why that is because of compensated shock. Compensated shock will kick in your fight or flight and it will shut down all your blood vessels, massive vasoconstriction. Send all the blood into the core of your body for your heart, lung, and brain. So it'll shut off blood to your stomach and your skin, but you don't need it right now. And that will buy you about an hour of time.
And you're not saying after that hour they survive, you're saying that there's a stalling period.
Buys them an hour.
Yeah,
If it doesn't get corrected within an hour, they will run out of their compensatory mechanisms. Then they'll go to decompensated shock, which will then they will rapidly die.
Software.
Huh?
2 years.
What's that?
Your vital organs.
So yeah, to your heart, lung, and brain. Then after about an hour, it'll not be able to do that anymore. Then you'll rapidly lose consciousness, your blood pressure will crash, and you'll end up being dead pretty quick. And then if you get to that point and you're in decompensated shock too long, and they finally get you to a surgeon, and they fix the problem and load you back up with fresh blood, but you've been in decompensated shock for too long, and your organs are dead, your liver, your kidneys, your pancreas and stuff are dead, or your heart or your brain. Then you go into what's called irreversible shock. You lie in ICU for a couple of weeks on a ventilator until you finally die. Pretty ugly. Yeah, once organs are dead, they're dead. Yeah.
That's like the.
No, because the organs are dead. Only time you organ plan when the brain's dead and the other organs are still healthy. Yes.
If the brain's still alive, can you do organ transplant on an irreversible?
Actually, it's the opposite. The brain's dead, then we do organ transplant, the organs are still good.
Well, I think you're saying that they get organs. The brain is still alive, but they get organs or replaced.
Maybe, not likely, not usually, because usually when you get an organ transplant, it's from a disease process on one organ. Does that make sense? Like you get kidney failure or liver failure. When you have your kidneys, your liver, your spleen have all had lack of blood flow and they're all dying at the same time, that's pretty impossible to survive. All at the same time, yeah.
I don't think they would even do it because I can't actually tell how good your brain is.
Yeah,
It's like,
So-
are we getting a bird, are we gonna do it?
so we actually, believe it or not, in EMS, we do a lot of irreversible shock. We get there a little too late, don't get them into surgery in quite enough time. They used to have a whole facility in Manchester called the subacute facility, people are on ventilators that never wake up. So. All right, any questions on the progression of shock? Hey, Fred, any questions on compensated shock? Where the golden hour comes from, it's that 1 hour. That's compensated shock, it's the golden hour. You can get them into surgery within 1 hour, the time of what happened to them. Not the time you're dispatched, not the time you arrive at scene, not the time you get them to the hospital. If you can get them into surgery within 1 hour, the time that they were injured. Got over an 85% chance that probably survive. That's why trauma centers are critically important. So how do we know someone's in compensated shock when we're out as EMTs? Well, first thing you do is remember this is fight or flight. Saber-tooth tiger just scratched you, you're bleeding out. Got fight or flight, so just kidding. So you're gonna feel anxious because it's a massive adrenaline rush to your body to make that fight or flight, get that vasoconstriction, dilate your bronchioles, shut off blood flow to your GI tract. Your skin's gonna become pale because there's no blood in it. You have moist, wet skin because that's a byproduct of the adrenal glands releasing that makes you sweat. Heart rate's gonna go up from that adrenaline. Blood pressure's gonna go up a little bit. You're gonna feel restless and anxious. You're also gonna feel short of breath because your bronchioles are gonna dilate, but your body needs as much oxygen as possible, so it's gonna tell you you're short of breath. This is a big one. Feeling of impending doom. If your patient says, I'm going to die, believe them. They usually do. People know when they're going to die. Elevated respiration, you try to get as much oxygen as you can for the cells. Nausea and vomiting, 'cause there's no blood going to the stomach, just like the skin. Capillary refill times delayed skin, there's no blood out there. Marked thirst, because you're gonna want to try to get as much water in as possible to get as much blood going. And then towards the end, the compensated shock, not enough blood to get to the brain. And you're gonna get an altered mental status.
How are the major organs that shock tries to save their starts to shut down first?
Usually it's kidneys. The kidneys, liver, pancreas, spleen, those ones.
Like the heart, lungs, and brain.
Our lungs and brains usually stay perfused. That's where the blood goes to.
But at the point of decompensated shock, like when your
Yeah,
brain
the
starts
brain,
to
the heart.
go first.
It's just depends. Yes, but it's not from volume. It's not hypovolemic shock. You would go into shock from like decreased respiration. So there's no oxygen. It's called a hypoxic shock, which isn't really one of them. No, usually your heart beats slow because it's hypoxic. Lack of oxygen.
That also like affect the restriction.
Yeah, because generally it's drug overdose. It's on a central nervous system depressor. So it depresses the central nervous system, which also controls your dilation of your vessels.
So you can also get just dilation.
You could, just depends on what drug it is and what type of central nervous system depressant it is. Like narcotics, generally, the respiratory depression will kill you long before the vasodilation. Decompensated shock starts happening after about an hour. That's not a set 1 hour. That depends on your age, your health, your conditioning. Yes.
How long does that last?
Nobody knows. So I think it depends on who you are and what kind of physical condition you were in prior to the accident. The worse physical condition you're in, the faster reversible shock happens. Yeah, the better condition you're in, the better that your vascular system is and your cells to adapt, the better your chances are. I can give a war story about a guy that was, I want to say 57 or 58, that got buried in a rock slide. Yeah, and was in decompensated shock by the time he got unburied. And got into surgery way too late. And that was probably 15, 16 years ago. And that guy's still walking around town and driving. But he was also an immaculate physical condition at 57, 58. He was still climbing mountains. He would climb Black Butte, not a problem. I mean, it's just he was an outdoors active guy. Like I said, if he was an average guy or a couch potato, he would never made it. Exactly. So how do you know when someone's crashing, which we call decompensated shock crashing? Their skin becomes ashen, mottled, or blue. Systolic blood pressure starts to dive. Lose your peripheral pulses. Labored irregular breathing. Pupils are fully dilated from all the epinephrine that's down left. And shortly after that, Grim Reaper appears. The additional resource you don't want to call.
Which one is going to present like most obviously?
The Grim Reaper. Skin signs always. Grim Reaper. Cyanotic means blue tint to your skin. And believe me, when you see it, you'll know. You go, oh, I know what that is. It look blue can actually also sometimes be purplish. Probably because she, no, it's probably it's hypoxia. So it's probably because she was already starting to seize in her diaphragm and her condylar muscles. I don't know. I don't know. Not perfusing well. Irreversible shock. Any questions? Organs been deprived of oxygen nutrients for too long, it will be dead. There's no coming back. It's not a soap opera. It's not Marvel Comics. They're dead for good. Cannot replace organs. Idaho, Washington, or California. They're gone. No eat Oregon. It was weak. It was weak, I know. Rough crowd. So what are we gonna do for these shocks? Depends on what type of shock it is. So for cardiogenic shock, we talk about heart failure. I'm gonna put them on high flow tube. I'm gonna keep them in a sitting position because when they lay down, there's too much weight in their chest, lungs start filling full of water. Or you can't beat all the weight of the chest on there. Don't let them walk. Least amount of physical activity as possible. You don't want to increase that oxygen in when the heart's already too weak to pump. And transport as soon as possible and get advanced life support there because they actually can pace and give some drugs that may be of benefit. That's not good for much, but situations like that, they might be helpful.
Wait, what is?
What's that? Advanced life support, paramedics. Come in their wings, their chariot.
And then you.
Yeah, they would pick that up. Not really. But in this situation, they could be very helpful. I could make fun of paramedics because I am one. Only paramedics can do external phasers and drugs. Yep. How most people do it. All right, hypovolemic shock. This is when you bleed out or you get real dehydrated. What do we do for these people? Also, high flow tube. Be prepared to ventilate. Stop the bleeding. Get them to a surgeon to repair the bleeding vessels. Advanced life support is not nearly as diesel is more important than advanced life support intercept. If you can get it, they can get a couple large bore IVs to help out, get them in surgery quicker. That's great, but don't delay transport or wait for them to get there. Start moving. These people need surgery now. They need to be there within 1 hour of the time of the accident. They need to be on the table being cut open.
How effective is like the air ambulance system out here?
It's not.
It's not at all, so it's kind of,
Not if you're in shock.
Yeah.
'Cause it takes, you gotta get a dispatch. The dispatch centers are like in Kentucky or Mississippi. So you gotta make a phone call to them, then they gotta dispatch them. They're not, it's not like they're sitting in the helicopter with it wound up. You gotta go out, get the helicopter, take off the tie downs. Or it takes about 20 to 25 minutes to get off the ground. Then they gotta fly to wherever you're at. Then it takes about 5 minutes to land, take air off. It takes another 10 minutes to package. Then another 5 minutes to get at lift again and get it going. And then they gotta land again wherever they're going at. So it's almost impossible to get there. It's about a 20-minute flight time for them to get here, but I've never seen them get here in under 45 minutes. There's 2 in Reading and 1 in Medford. We have one in Klamath Falls. It's gone now. The closest was in Ayden, was actually the closest, but it's gone now too. Yeah, we've actually lost 2 health air ambulances in the last year, unfortunately. Overhead costs, cost too much to stay in business. Lots of endless red tape, regulations, and costs. And very little reimbursement. Free doesn't pay well. You know, free healthcare just doesn't pay well. Yeah. Yes, the flight paramedics. Any questions? So generally, well, the way they use our ambulance here is they get you into surgery, stop the bleeding, then if you need a specialty type surgeon, like a neurosurgeon or an ear, nose, and throat surgeon or something like that, then they fly you to a university hospital that has this.
Gotcha, so they stabilize locally and all.
Okay, you get them the fastest way possible to the closest trauma center available, is what you do. Any questions? All right, distributive shock. What do we do? High flow too. Be prepared to ventilate. Sounds familiar. Remove them from the causative agents. So this allergic reaction, get them away from whatever they're allergic to. Package the patient for transport, keep them warm. Transport, consider advanced life support intercept if you can and it's available. Any questions about distributive shock? Yes.
When you say ventilate, do you mean like a
BVM.
or
Or the BVM, that they don't have a gag reflex, yes, you should put a supervisor. What was your question?
That includes the septic, urogenic, and electric.
Psychogenic, but you'll never need to treat a psychogenic because it's 100% self-correcting. Keep them supine, they'll wake up. There will be a test question though about checking to see if they were injured when they fell, no one caught them. Yeah. I saw a guy once on an OB tour of the hospital with his pregnant wife. They're explaining the things that go wrong with the pregnancy and psychogenic shock. Bam, he went right into a table. Bonk. Oh, man. Fortunately, he was inside the hospital. Nope. All right. Pay attention. It's our first case history. See car. See pedestrian. What could possibly go wrong? Pedestrian attacks the car. This nice neighborhood, blown red light. Goodbye, pedestrian.
You got squished.
Like 5 times.
All right, case history. Your patient's been run over by a vehicle that rolled over on top of him while he's crossing the street. What do we do first? Scene size up, PSI, how many patients? Do I need additional resources? Should I consider spinal mobilization? Probably.
Like I said.
Everybody's got their BSI on. The scene is very safe. Traffic's controlled. Decking is injury. Patient had a vehicle roll over on top of them. It's your only patient. You have lots of resources. What's next? Primary assessment, airway, breathing, circulation, stop the bleed. Don't order oxygen until we know if they're breathing adequately or not, then we order the appropriate oxygen. Your general impression is a badly injured patient. He's not alert, he does not respond to your voice, he does not respond to pain. You've determined he is. Thank you. Circulation. He does not have a radial pulse, but he does have a weak carotid pulse. His airway is clear. He is breathing 12 breaths a minute and shallow. Is that adequate?
No.
No. What do we do? Put him on a non-breather?
Yes.
Yeah? No, BBM. Never follow me down a rabbit hole like that. Come on, people.
Don't trust this guy.
Don't trust me. I always lie to you. All right, the skin size is pale, cool, moist. Is he a priority patient?
Yeah.
Absolutely.
How big was the car?
It was a smaller SUV.
5 tons.
Still only weighs 4,000 pounds.
He can walk it on.
What comes after the primary assessment? I heard someone say it.
Secondary assessment.
No.
Sample.
History. He's unresponsive and nobody knows him. But you try. What's next? OPQRST defines your symptoms of your signs and symptoms. What was the onset? What provoked the pain? What's the quality of the pain? Does it radiate? How severe of it? And the time of the episode. Is it episodic or is it constant? OPQRST. We'll go over that medical assessment. It doesn't really apply to trauma. What's after history taking? Secondary survey. You guys need to know your GCS. You've had ample time to memorize it. Blood pressure is unobtainable. Blood pressure, pulse rate's 152, his respiration is 10 and shallow. He's going the wrong direction, kids. His eyes don't open. He's got no verbal response, no motor. What's his Glasgow coma scale? 3. That's an easy one. But at least he has room for improvement. It's not going to get worse than a 3. All right, head. He's got multiple abrasions to his head. His eyes are swelling with dark ecchymosis. What's ecchymosis mean? Well, it's discoloration of the skin, but yes, those are raccoon eyes. His neck's negative. He's got crepitus to one side of his chest. Crepitus is when you palpate and you feel and hear crunching sounds of broken bones. Ugh. Abdomen. Oh, wait, lung sounds. Diminished bilaterally and absent the bases. So when you listen to the base lung sounds, you don't hear anything. He's not breathing well enough. Abdomen is firm and slightly distended all quadrants. That's indication of a bleed. You probably a ruptured, fractured a liver or a spleen or both. Pelvis is stable, amazingly enough. And his extremities just have road rash. Second set of vital signs, not improving, going the wrong way. What do you do for this patient? Transport. Diesel. Where to? Exactly. And let them know immediately. All right. Any questions? All right, let's learn about trauma. Who wants to learn about trauma? All right. So last week, I went through this entire presentation, made sure there's no broken links. Every semester, we get into trauma. YouTube folder I got Sunday. Better have no broken links tonight. I just went through this. I do have a consistent standard of, or a consistent pattern of violating the cleaning standards for educational purposes. All right, thoughts of the day. Any job that's ever existed, no matter how small or how large, has challenges and obstacles, cannot be avoided. You have to accept those challenges and obstacles and overcome them. Who you are as a person, the height, the quality you hold yourself to is the largest factor in overcoming any problem, any obstacle, and every challenge in your personal life. You will be to overcome those challenges and obstacles are chosen by you, nobody else. The challenge that you have will stay with you no matter what happens. Only you can make choices on what tool to use, the path to take to overcome the challenge and the obstacle, and in the end, the success of whatever you face will depend on your preparation, your education, and your choices, not anybody else. Other people will set the challenges and the obstacles, not question. How you respond to those challenges and the obstacles will be completely up to you. You will have only you to blame with the end results. Any questions? All right. Objectives. We're going to define mechanism of injury. We're going to go over energy and trauma and how it affects the body. What's the differences between penetrating and blunt trauma? They are very big differences. We're going to go over the 5 different types of motor vehicle crashes. We're going to go over what defines multi-system trauma and what the trauma system is and how it works. Questions so far? Probably won't get through this today. Injuries are the leading cause of death in young people, traumatic injuries. Kinematics. It's the physical concepts of energy and how it moves, and how it affects the human body when applied to a human body. Any questions?
Or is it just something that is good to know?
Good to know. You know, that's what you do, physical computations out there. But we have you need to have a basic concept of energy and energy distribution. Does that make sense? Someone gets ejected from a vehicle 50 miles per hour and a vehicle right on top of it. That's millions of pounds of kinetic energy being absorbed by soft tissue. So energy and trauma work is defined as force acting over a distance. Kinetic energy is the energy of a moving object. The potential energy is the product of weight, gravity, and height that is not in motion yet. Any questions? Is there anyone who's never seen an episode of Bugs Bunny Roadrunner? Those are the best cartoons ever for potential energy. There's always a giant boulder sitting on top of a little tiny peak, waiting to fall on Wile E. Coyote. That is potential energy. Then it starts working, exactly my phone, and now it's nonstop. When it starts working energy is when that rock falls, then it's working. When it lands on top of Wiley, that's kinetic energy going into Wiley's soft tissue and crushing. Fortunately, there's great trauma centers there. He's always back for the next scene. Huh? No, work is when it's actually moving. It's force acting over a distance. Hey, look at this. There's potential energy right there. That's good. There we go. Great. Potential energy. What? That's never. All right, so energy distribution. So how do you stop people from getting killed, falling off giant cliffs, being struck by vehicles, or being inside a vehicle that crashes? You have to disperse the energy. One of the best ways of dispersing energy is K-rails. Concrete walls, center dividers. Those things that happens is when you get an impact of energy, it distributes the energy across the entire wall. That's why it's hard for those things to go through. They put it for a military base, you always wonder like, how is a wall this tall gonna stop a truck from going through a military base? They can actually show you. So for those of you that want to figure it out in the field, kinetic energy formula is half times the mass times the volume squared. But no one expects you to do that in the field, and it won't be on the test. But for curious minds, so you got a 65,000 pound truck traveling at 50 miles an hour, 5.5 million feet, 5.5 million foot-pounds of kinetic energy. How's a 4-foot concrete wall or a 3-foot concrete wall going to stop that? There's no way. Watch out, Paul. Any questions on how to redistribute energy? So the entire wall absorbs it. It's just like an airbag. Airbag comes out at 200 miles an hour. You hit the airbag, it disperses that energy. So instead of you hitting the pavement or hitting the steering wheel on the dashboard at 70 miles per hour, it absorbs energy for you. Same thing with a seatbelt. The seatbelt is webbing. And that's how you can always tell if someone's actually wearing their seatbelt or not. CHP, the person will check, is the webbing of the belt. The webbing's still tight, they weren't wearing their seatbelt. If the webbing actually gave them ride down time, so your body's traveling at 70 miles per hour, leave me alone. Forgot I'm an ET class. So your body's traveling at 70 miles an hour. So say your body hitting the dashboard, the windshield at 70 miles an hour when you hit a big rock in the road. Your seatbelt absorbs that energy and distributes it across the webbing. And it slows because it's called ride down time. And it slows your body from hitting the steering wheel of the dashboard at 70 miles per hour. Because that energy is distributed through the webbing of the belt. And then after the wreck, the belt's all loose and floppy. You ever buy any used car, it's the first thing you should check. Is the seatbelt. The seatbelt's loose and floppy because nobody ever replaces the seatbelts after a wreck. They'll go to a body shop will fix it, make it nice and pretty, then you go sell it. And yeah, the seatbelt will still be like, it's like this car's been wrecked. No, it hasn't. Yeah, it is. Show me the Carfax.
What about child lock seatbelts?
What about child car seats? What do you mean?
No, or when you pull the seatbelt all the way and then it makes sure that they can.
Automatic locking retractors?
Yeah.
So automatic locking retractors are amazing if you use them properly. So like in children, not quite sure. I've seen the ones where you have the adapters where you put the belt down so the belt doesn't go across their neck, because that'll kill them. Or you're talking about when you install a car seat, pulling the automatic locking retractor all the way out.
No, I mean, like,
The function of the seatbelt when it does the hyperextension and like tightens.
With my seatbelt.
Well, if it's
Just like.
an ELR, then it's locked like what you're talking about. But an ALR doesn't lock until it goes all the way out unless it's on what's called a pendulum. And unless that pendulum hits a certain amount of degree of G-forces, it doesn't lock. You have freedom to move.
all right, so even when it marks up, it's gonna give you some amount of.
No, it's like when it walks, it's not gonna give you anything, but it's gonna stretch the webbing of that belt. What's gonna happen? It's gonna give you the ride down. But it'll walk. That's what always cracks me up. At a girl once a long time ago. I was telling you, make sure you put your seatbelt on. It's important to give you the ride down time. And she goes, that doesn't look. Seatbelts don't work. And she's pulling it back and forth like that. So I just slammed my brakes on. She goes, clink, like that. And goes, oh. No concept of an automatic locking retractor.
What was the formula again?
Formula, it's not gonna be on the test. You don't need to know it. But if you want it, it's right there. No one expects you to know that. All right. No, we already watched you. No, I watched that. All right, so blunt versus penetrating trauma. Blunt trauma is when you have kinematic energy distributed across all the soft tissues. Penetrating trauma is when kinematic energy penetrates through the tissue. It goes through a focus point, kind of like knives and bullets. Any questions of the difference between penetrating and blunt? Penetrating penetrates, blunt does not. Which one do you think is easier to survive? Penetrating is more focused in one area, much easier for a surgeon to fix. Blunt trauma gets redistributed out. Very impressive. You went out and found proctors. Good job.
We were lost, now we're found.
Huh?
We were lost, now we're found.
So I said, I said, you need to go find some proctors.
Oh, sorry.
Yeah.
He's on hold. The injuries do not penetrate soft tissue and organs. Wouldn't it though, like a form of bruising or some kind of?
Right, the blunt trauma, it absorbs energy and that's what creates the bruising. It absorbs it, but it doesn't break the skin. Penetrating breaks the skin, blunt trauma does
Oh,
not.
the word penetrate is not that it doesn't damage it, it just doesn't cause it.
Correct.
Oh, I see.
And blunt trauma is way harder to survive than penetrating trauma. It's much better to be shot than hit by a truck.
Penetrating trauma would be any kind of, even if you got hit with like a blunt object and just split your skin open, it would be penetrating.
Yes. So mechanism of injury is the way that energy is introduced into the body. We're going to go over that in great detail right now. So the most common type of trauma that you're going to see is vehicular crashes. They happen daily. One thing about humans are, they don't drive well. So when there is a vehicle crash, there are 3 collisions. There's the car hitting whatever it's hitting to crash. Then there's the human inside of the car crashes into the interior of the car. And then the internal organs of the human's body crash into the skeletal structure. All at the same speed that they're traveling, unless they're wearing safety restraints that give them ride down time. So there's 5 different types of motorized motor vehicle collisions. Frontal, lateral, rear end, rollover, and spins. We're going to give you examples of each. Frontal collisions is when you have kinematic energy introduced to the front of the vehicle.
Coming to turn 1, don't forget, he had just stopped. Watch this car move right here. Something breaks on that car. He clears the traffic. And huge contact with the Armco, and watch Jimmy climb out of the car and say, yeah, guys, I'm okay.
And went into a complete ride down time wall that distributed the energy. Next slide. Beep. This is a great picture of the 3 collisions. So this dude hits a telephone pole. She's not wearing a seatbelt, so she goes flying. So he's doing 30 miles an hour, hits the telephone pole at 30 miles per hour. She goes flying into the dashboard at 30 miles per hour, and then her hip and her femur get crushed at 30 miles per hour and it blows the femur right out of her pelvis, breaks her hip. It's a great video of the 3 collisions. Now here's something we hope you'll really. Her. So look at this with the mechanism of injury and the debris and tell me what you think might be important. What do you see? Lot transfer energy, what goes flying out of the car? Huh? Yeah, what kind of objects? I didn't say people. Oh. Children's school stuff. Oh. I think that one you get to see them fall out though. No. Nope. Still in there. So another in there.
They're a part of the car now.
Who gets to see some ejects before the man's over? It's a parked car. Major front end impact. Hit a parked bus. Bus didn't go up.
Knew it was coming.
Any questions on frontal collisions? Oh, here's some more.
Is there anything with like how much energy, or I guess like a speed, if you're going 70 miles an hour in a seatbelt and you hit something, like, is there anything to calculate, like how much is reduced in terms of impact?
Yes, there are physics out there. I don't know them. But they do exist. You can look that up. So you got that much snow on the road? I got a good idea to drive that fast.
What?
Everybody driving too fast. I don't know. Still all happens so fast. Big time whirlwind. It's a roll. Like the Alice teacups at Disneyland. The chase is over. That's they finally decided to pull over. Get his license plate.
Yeah.
I don't even know how this happens. You never really saw it. That's a big truck. What's that? No idea. Total if the damage to the cost to repair was worth it.
When there's snow on the road, you can't travel.
This is the first one. Way too fast. We're not paying attention.
It's the car.
It's the first floor. Whoa. All right, you guys have any questions on front of the collisions? Go back and watch this on your house now. All right, let's look at some rear end collisions. Already saw this one. That's a frontal and a rear end. So rear end collisions cause completely different types of energy injuries due to the different types of mechanisms of injury and kinematic transfer of energy. So, for example, these ones generally cause your body to go forward and come back, which creates C-spine injuries, also known as whiplash. Any questions? Distraction, spine injuries. Lateral collisions are the most fatal. There'll probably be a test question on that. Body's, your aorta, your great muscles don't do well going sideways. The tendency to shear and tear. This right here is a fatal. It's not survivable.
And then out of nowhere.
Bye-bye.
Then out of nowhere.
And these aren't all laterals, but these are the most laterals I can find. Hello, Kitty.
Or the full guy.
Great lateral impact.
Better just not have a leak.
The energy is getting thrown through that car. It's not being absorbed. This one's amazing. That's checking the guy.
I was playing GTA. Yes.
Not gonna turn there. All right. There you go. Great lateral impact. And they got a strike.
So when the body's hit from the side, you were saying it shears somehow?
Yeah, your area, your great vessels, your coronary dana, tendency to rupture.
Just have kind of like the ridge.
Well, it's just the way the tendons are holding them, so they care from the force.
Oh, it's the force up the bones.
Yeah.
Oh, gotcha.
It's still going. Leak back, thumper. Rollovers. If you're restrained, you do pretty well. If you're under restrained, you become a lottery ball. Get 360-degree injuries. Those are pedestrians hit by a vehicle. So rollovers with ejections are very bad. So think about it. If you're not restrained, you're traveling your body and your organs inside your body, you're traveling at the same speed as the vehicle. So if you get roll over and then you get ejected, you're getting ejected at that speed or higher because it's catapulting you. then you're generally going the same trajectory as the vehicle. So after you go splat onto the ground, then the vehicle usually rolls over on top of it. Ejections are really bad.
News of a police chase on I-27.
We go now to
This
talk
one's
to Sean
spectacular.
Conroy, who's live in Skybox, and Sean, we understand this may have
This
possibly
guy's
started
going
after
so
a
fast,
shooting,
he
what can you
clears
tell
the
us?
4-lane highway.
Fun, actually, best we can tell.
And then gets ejected.
You can definitely tell he's headed eastbound on 40 at a very fast clip. That white Suburban we're following. Several police officers in chase, basically coming near Frontenac where this all began, near Lindbergh on eastbound 40. About 100 miles an hour, we're told right now, this white Suburban is line on eastbound 40. This all apparently happened at Bob Road in Frontenac with the shooting. This
Here he
chase
goes.
out west of
Here he goes. Clears 4 lanes. Rolls. Ejected. On his head.
Ejected from the car.
So slow.
Horrible crash.
Not getting
That was
out.
about probably near.
We didn't see the
Clayton
good
Road.
turn up to
Sean,
help.
just
Go,
unbelievable
oh.
video.
nothing
This
I
is
can do.
amazing. What can you tell us as far as the police officers? How many are on the highway? How many are chasing this vehicle?
We didn't see too many, Sandy. I look back, probably 4 or 5 right now, but many more. Obviously, were involved as this passed throughout West County. This was headed all the way up to page 270 before coming back east, as you see here, and ending just east of Lindbergh.
Yep,
Any
yep.
idea why this,
nothing we can do about that.
I'm sorry, Alex, what was that? Any idea why this person was?
Look at that 4-lane highway he crossed
In the
though.
first place.
He cleared
There's
it.
a shooting in Frontenac, legal on Bob Road, from what we understand now. You can see the first police officers arriving. I need to correct something. They were not that close to this suspect. They had backed off, but he was still charging at quite a
Nice
quickly.
lady.
Said, we estimated about 100 miles an hour at one point. The police officers have arrived. That person, as you saw, is ejected, is laying there on the side.
And Sean, these kinds of situations are always so dangerous.
Car stops at K-rail. Still might end up getting it really bad. Get you this, we got it in slow motion.
Okay, I would not want to be the person that
Oh.
drove over.
Oh, shit. Yeah, you'll never get it out from under your undercarriage.
Oh, damn. Oh my God.
Holy cow.
I got landed in my reversal.
But we're gonna see both
Yes.
prevent this. or-
Absolutely,
So
because you were getting
whether or
ejected.
Not prevent it fast enough, I guess.
Yeah, it will prevent you from becoming ejected, which is always better.
Right, yeah.
Let the vehicle absorb the energy, is what you want to do. You want to sit in the driver's seat or the passenger seat and let the vehicle absorb all the kinematic energy, instead of having it go into your body.
But the seatbelt wouldn't like break if you're going that high.
They're testing like 20,000 pounds kinematic, there's no way. This may be disturbing. We're going really fast.
Oh, the woman that was driving the car?
Yeah.
Oh, after that. Too much detail on some.
Whole lot of cases on that.
Yeah. Nice. Chick is determined. Yeah. Well, I mean, at this point.
Very
bad. At this point, if she pulls over compared to just, you know, getting ran off the road.
Yeah.
That's true. She's still going. The Reuters. No, I've seen this. Oh, you have.
It's like I was in the car.
Yeah. It's crazy. I know, like hog tie.
Yeah.
Flat tire.
I can tell you this, that's gonna end badly. She gets ejected. There she goes.
After that long chase, that's it.
Hit her. Here we go. There she is.
Oh, I see. I didn't see her at first. I thought that was just rubble.
Hit her, maybe park with.
Yep.
But that-
No, negligence on her part. She was endangering the lives of others. She made those choices.
Oh, the foot.
That's the Corbett posture. She's got the Corbett posture. See the elbows going out?
The handcuff her.
The handcuff to do that, and his head crushed too. Seeing safety. Look how fast the US is.
It's gonna be a good 10-minute
Yeah,
window.
these guys are fast. That's what I expect from you people.
I've never really understood why people stand.
Here you go.
That person that was 25 feet up in the air.
Yeah, there's the person.
That one guy was right.
So you got that one, you got that one. Double ejection.
It's a three
They're
word.
both up. Was it three? I don't know where the third one is.
Never came down.
It's one of those puzzles. He's in the tree. This is a good one. Yeah, she lived through this. His helmet doesn't fit.
Wait, like she kept racing in this
Muy
way.
bien hacer.
Yeah,
Parece que tengo una fractura.
if it is, she continues racing. This is fatal. That Raggedy Amber. Not good.
Red flag.
A lot of projection videos. Right over 'em. And that one. Multiple ejects. Any questions about ejections? Yeah, All right, spins. Jeep was a good spin. All right, people, cars versus pedestrians. Cars generally win. Things you want to know for the back of the injury is where did they get struck? How far did they get thrown? Did they get knocked up onto the car? Or did they get knocked into oncoming traffic under the other car, which is more common than you think? And these people generally often have spinal injuries. Here's a compilation video.
And if you want something to happen to you on
Why you'd be running on a racetrack, I have no idea. Messed up here. Come back to what happened here.
Watch this guy's shield.
Again, why would you be running on the side of a racetrack?
Oh, he put him on the other side of the barrier.
So this is a good one to pay attention to. This cop saves his own life. So you could have laid there and gone, man, that sucks to be me. Or he can get up and get the hell out of the way before he gets killed. He doesn't control what happens, but he controls what he does next. This is what the bottom of the Jeep will looks like. That's got to burn. How was it off? So this is what an EVOC class will teach you how to do.
Got it.
Drop the knife. All right, keep him away from me. I'll drop the knife. Hurt she died. I don't know if it's true or not. This dude's in pieces. There's his arm. Oh. So if you're at a scene like this, cover him up. Orange County. There's his arm. He's not bleeding. No blood. He died. His heart stopped before he got ripped apart. It was an instant kill. heart of COVID. June 27th, everybody's wearing masks. I'm drawing to the guy driving the vehicle that hit him. Oh, his leg, not his arm, I'm sorry. All right, falls. You want to know for falls, the height of vertical free fall, what body part hit first and what type of surface did they land on? Yeah, that's real. That is very real. But trapdoors are a really bad idea.
Oh, God.
Belly flop. The gene pool.
Belly flop, belly flop, belly flop, belly flop, belly flop. I got him down. No. Oh my God. Yeah, go on. Holy. Oh. Oh. Oh my God. Oh my God. Dang. That was a stupid idea. You all right, man? Right, look at me. Broke your nose again, that's great. Good time. Do you have any base? That was awesome though. Take the picture. I'm recording it.
That's why you need to listen to engineers that talk about tip load. Which way to the tip?
Ocurrió en la frontera entre España y Francia. Dos bomberos rodaron 70 metros al soltarse de un cable de un helicóptero cuando simulaban un rescate en una montaña. Sus cuerpos, como estamos viendo, golpearon en contra de las rocas y ambos sufrieron múltiples fracturas. Uno de ellos incluso sufrió contusiones en el cerebro, pero sorprendentemente los dos sobrevivieron.
So, there it is. Yeah. Somebody tried to get down, somebody figured out what was wrong and turned it on, and this is the worst though.
I've seen this video.
Decapitation.
Yeah.
Right there.
Oh.
If that was too fast, we'll slow it down and circle it for you.
Thank you.
Anytime. What the hell?
Huh, he's chilling.
Huh?
I don't trust fairground.
I don't know if it's gel or not. It's kind of mind blowing.
See him on a semi truck one day, the next day.
Where was that?
Some third world amusement park. I have no idea.
I think it's Six Flags. This person climbed over the fence to grab their hat.
Shoe or his hat, yeah.
His hat.
And then foot decapped him. That was a magic fountain.
Yeah.
Yeah, wait.
I went on that ride a year before. With
Yeah, well,
my knee and
the
it
person
happened.
came by it, It was one of those suspended. The train came through and it hit the kid in the head, the foot hit the kid in the head, decapitated.
It was her knee.
Her knee, yeah.
Oh my God.
Somebody's head on.
Sitting in a suspended, it's a suspended swing style roller coaster. So your knees are exposed.
Oh, okay.
These guys, I want to have a beer with, if I ever find them. Accident, but the way they handle it, kind of people I just like that.
You know, you can try it? Look at the penalty for failure, dude. Shit, that's a hell of a fucking job. Oh, no, really, dude. Be careful, that's a hell of a, oh, shit. Oh, my God. Oh, hell. Oh, shit. Oh, you're right. Did you kill it? Yeah.
Wow, what good.
Hey, just sit down, sit down, sit down, sit down. Miles, until you know everything's connected. Sit down.
Stay down until you know everything's still connected. Oh, shit. You gotta watch this one twice. The audio is way better than the video.
You know, you can try it? Look at the penalty for failure, dude. That's a hell of a job, Miles. Shit, that's a hell of a fucking job. Oh, no, really, dude. Be careful, that's a hell of, oh, shit. Oh, my God. Oh, hell. Oh, shit. Oh, you all right? Did you kill it? Yeah. Hey, just sit down, sit down, sit down, sit down. There, Miles, until you know everything's connected. Sit down.
Those guys are so. All right, penetrating trauma is the second largest cause of death after blood trauma. It's number 2. Greater the speed of penetration, the more kinematic energy, and the greater the injuries. We're gonna go a couple more, then we'll go to break. It's not looking good. Oh, it's there. I thought for sure they pulled this one.
Oh, Rittenhouse.
Yeah. I was watching this live in a hotel room in Medford. And I said, I gotta get this for EMT class. I couldn't believe it actually happened on live, just live. I just put it on the drive, so it's separate from YouTube. Yeah, YouTube pulls it. Even though I got it off YouTube Live when it happened. Heck, where are we? This is an impressive gunshot wound. Are you hit? Are you hit? Maybe.
Ouchie.
Apply direct pressure.
Look at his hat. I don't know if you can see it.
That
His
guy
hat
ended up
says
dying,
paramedic.
right?
No. He was a paramedic that lost his license for arms violations and alcohol violations. Firearm violations. So distracting injuries, before we go to break, this is another one, same riot. But distracting injuries, so this is also a thing of why you should not claim that you're a medic when you're not a medic. So distracting injuries is when you see something that distracts you from what's actually killing the patient. That's why you always have to do a full and complete assessment. So in this case, the guy is shot in the pelvis. And as we know, the pelvis is where the femoral artery and the femoral vein are. You will bleed out very quickly. But he hit his head when he fell down after being shot in the pelvis. And the medics, which were not actually medics, they just identified as medics that day, and wore classes of medics that gear, addressed the head wound from hitting his head as he went down, but never looked at his pelvis when he bled out. And he died. Never step over your patient. It's his head, it's his head. It's a scratch. Video it. Look at the BSI.
I didn't.
Put pressure on his head. All right, go to break. Be back at 5 minutes after 8, ready to go into teams. Five minutes after 8, 8:05. Looks like a beer. End presentation before I say something else.